Nurse Awesome. I got a viewer request asking me to talk about how to organize a care plan. So that's what this video is going to be about. So care plans, they're kind of a pain. Sometimes they're really an awesome tool that help you kind of figure out how to take the best care of your patient. They are technically a reimbursement tool. They are a roadmap for patient care. They're a guide that really help you plan your day. They are individualized and they are comprehensive. It's a way for you to say to your patient, hey, Mr. Patient Man, I see and recognize that you're having some issues with this. And since you're important to me, I'm going to make a plan to take care of those issues. It says, hey, I see this problem because of this sign or symptom, and I'm going to do this about it. Your job as Nurse Awesome is to fill in the thises all throughout those statements. Remember that nursing care plans are based off of nursing diagnoses, not a medical diagnosis. And the difference is real simple. A medical diagnosis is something that the doctor does. It's doctor dependent, and it doesn't ever go away until that disease process resolves itself. A nursing diagnosis, well, that is something that changes as your patient does. For example, congestive heart failure is a medical diagnosis that requires a doctor to determine. It doesn't go away as long as your patient has CHF. It's going to follow him around. But your nursing diagnosis, well, for someone that has CHF, one day that could be something like decreased cardiac output or altered mental status. And then as your patient resolves those conditions, or maybe becomes worse within those conditions, your nursing diagnosis, your care plan, what you are going to do about that particular sign and symptom is going to change. It may become anxiety or impaired family process, or there may be some huge knowledge deficit that you find you have to teach. The key here is for you to remember that a care plan is something that is fluid, not static. It changes as your patient does, all right? All right, so enough about that. How is it that you're going to organize yourself? Well, the most important thing I think to remember about a care plan while you're doing it is that in order to create a kick-ass care plan, you really have to do a great job of gathering data, of assessing your patient. You have to really be that detective and kind of not overlook anything that you think may be insignificant. So you're going to gather great data, but how exactly are you going to organize that data? That's a great question. You're going to develop your own style of organizing your data as time goes by. Here's what worked for me. I took, that brain sheet that you use with like your review of systems and your history and your medications and your lab values and all that. Well, I would take that information that I had gathered from my patient and I would sit down with it at the break table or the nurse's station or the patient's room, wherever I could find a spot. And I would say, well, here is my symptom or my assessment data. And I would make that in one column of a fresh sheet of paper. Oftentimes it would be the back sheet of that brain that I used to gather data on in the first place. So I kind of had it all in one place. And I would list out the signs and symptoms or the assessment data that was pertinent, everything that I saw all inside that brain. My vital signs, my heart rate, my BP, my respirations, the eyes and nose for that shift, the lab values, my patient's lung sounds, how they were psychologically, what kinds of social or cultural issues that I may run into, what sort of spiritual condition were they in, all of that listed on one column. That was my assessment data. Then I would just draw a line, and in the next spot I would put very simply, why is it important, and why is it here? So basically, if I would say my patient had an increased heart rate, say they were tachycardic, why is that here? Well, because they have a decreased contraction based on their CHF, right? And so that means their heart has to work harder to circulate blood through their system the way that it used to, right? Well, then the next thing that I'm going to ask in a new column is, what can I do about it as a nurse? Well, I can't fix my patient's heart rate, right? I could give them a medication that the doctor prescribes, but remember, care plans are really after your independent nursing actions. So the best thing that I can do to help with my patient's heart rate is to do things that support the patient so that their heart rate doesn't increase anymore. So I may cluster care, I may help them set up their tray, I may help them perform hygiene, I may make them dangle at the side of the bed before they get up. I'm going to do those things that decrease the workload on their heart. That's the only way that I really, as a nurse, without a medical degree, can support my patient's situation, right? So I do that for each one of those assessment data pieces. So remember, assessment data in one column, why is it important, why is it here in another column, and then what can I do about it as a nurse in the other column. And then starts the real job of the care plan, which is trying to prioritize and decide what you're actually going to spend time on in that day. This is really governed a lot by what your individual program tells you is important. My program, for example, always wanted us to include a knowledge deficit, so we always had to teach our patients something, and that had to be one of our nursing diagnosis statements, right? So what you really are after here is what is it that is going to keep your patient the safest? What is it that's going to harm your patient if you don't do something about it? Let's take, for example, in CHF. If you see that your patient has really positive ins and outs, right? So they're taking in too much fluid, and in conjunction with that, their heart rate is a lot faster that day, and also in conjunction with that is the fact that their lung sounds are getting a little crackly, kind of sounding a little wet. Well, that may mean that you need to plan to do something for your patient that can help them diurese. You may need to restrict their fluids a little bit. You may need to set the head of their bed up so that they have better expansion in their lungs and that they're draining a little bit better. It may just mean that you need to point that out to the doctor so that they can do something about it. The main key here is when you're organizing yourself in this way, what it does is kind of break things out for you, and it forces you to look at each individual situation and consider, is this a life-threatening thing? Is this something that is a safety issue? Is this something that I can do later? And if you'll kind of make a little tick mark on those things or highlight them, however you want to do it, that says, yeah, this is super duper important. Yeah, this may kill my patient. Those are the things you better make sure that you plan for whenever you're doing your care plan, okay? And then, you have to make sure once you've picked something and decided this is a priority, that you actually have enough data to support it. So there are some other videos that talk about creating your nursing diagnosis statements and your goals and interventions. So you guys go peep those. In the meantime, take heart, guys. You are not going to do care plans the same way you do in nursing school once you get to be a nurse. The thing is, though, all of those interventions that you did, they're just like embedded in your head so that you do those things automatically. For example, now when I have a patient that has CHF, there is a list of things that kind of fire off in my head that I know I'm going to watch for because those are danger signs. And I know that I'm going to do as an awesome nurse to take excellent care of my patient, right? All right, so I hope that's helped a little bit. Organization is really just about breaking things out. Use this little 3-column method. What's the symptom? Why is it here? Why is it important? What am I going to do about it? And then prioritize your list of goals and interventions based off of that particular organized piece of data, all right? If you have any more questions, you just feel free to email me. You can get me at melissa@nurseawesome.com. Peace, y'all.